This is Selma Schimmel for the Group Room at the ESMO 2012 Congress happening now in Vienna. And we are joined by Dr. Gouri Shankar, Bhattacharyya, head of the Department of Medical Oncology at the Fortis Hospital and Assistant Professor of Oncology at the Chittoranda National Cancer Institute in Calcutta, India. He is also on ESMO's Developing Countries Task Force. Welcome to the Group Room.
Thank you. It's my pleasure to be here.
Let's start with the ESMO Developing Countries Task Force.
One of the biggest things that the ESMO as an organization has done is to understand that we need a developing countries task force. And developing countries have to be brought into parameters. The reason is that as we learned today, the maximum number of cancer patients all over the world are in developing countries. The maximum number of cancer deaths are in developing countries. In fact, 70% of all cancer patients are in developing countries. 85% of all cancer deaths are in developing countries.
Approximately how many developing countries are there that are affiliated with the ESMO Developing Countries Task Force?
If you're asking for directly as members on the task force, the members were selected on the basis of regions rather than individual countries. Members came in from Latin America. Members came in from Africa, the Sub-Saharan and the Saharan Africa. Members came in from Eastern Europe. Members came in from Southeast Asia, and members came in from the Australian areas. That's how the Developing Countries Task Force was formed.
How do you make the association of the incidence of cancer being so high in developing countries?
The question is because your population divide as such that 20% of the world population live in the developed world and 80% of the population live in developing countries. The term of that's how we see a high prevalence and high incidence of cancer in the developing countries. The question is the sheer bulk of numbers. When ESMO realized this as a problem, and it also realized that all the cancer that people are talking about, its treatment, its management, prevention, they're looking at those 20% who live in those 10% of the affluent countries, but the rest of the world was not being looked upon. And that was the beginning of the developing countries. And this is one concept we owe it to a lot of people, to people like Dr. Adamos, who has been the chairman for this committee, Professor David Kerr, who was our ex-president, the present President Martin Picard, the whole lot of people who started this thing and kept it running because they were able to show that ESMO was a society that cared for the globe, just not for Europe.
Would you be able to define a developing country? What's the criteria to be considered a developing country? What distinguishes a developing country?
The term developing countries or developed countries do not come from any scientific developments. It comes in terms of your financial earning, per capita earning, which is laid down by the IMF and laid down by the World Bank. It says that if you are earning less than $4,000 per annum, you are a least developing country. Between 4,000 to 10,000, you are a developing country. And if you're more than 10,000, you are a developed country. These arbitrary figures have been brought about by a certain economic analysis called Gini's Index, which shows what you buy from. In the same breath that I will continue, that there is a problem because the data may be skewed. Like for example, I come from India. There is a population of 1.2 billion. We are a developing country. And on paper, we are supposed to be actually earning close to $6,500 per annum. That's supposed to be our GDP. But if I look at it, 70% of our populations are living below $2 a day, which is much lower. So it tells you that data can get skewed if one is not looking at certain parameters.
Is part of the reason for this high incidence of cancer and mortality in these developing countries due to poor access of medical care, lack of early diagnosis, and perhaps a shortage of innovative therapies?
Let me put it this way, which will never appear on any death certificates or anything, is poverty is the #1 cause. The poverty creates a vicious cycle, and the vicious cycle is, for example, it doesn't allow you to get into the natural habits of living a good lifestyle. For example, the number of tobacco smokers are today higher in the developing countries rather than in developed countries. In fact, the majority of new cigarette smokers are from developing countries. Younger patients start developing smoking at the developing countries faster than they do in the developed country. For example, if I put it across to you, it would say that 70% of all smokers are today in developing countries. In fact, the ban on cigarette smoking, the ban on use of tobacco in the Western world has increased the incidence of use of tobacco in the developing countries. And now, to put it in a different manner, that tobacco as a single agent occurs for all 40% of all cancers that occur all over the world.
Is it that there's greater exportation of tobacco into countries to compensate for the developed countries where there's less tobacco sales, so now sales are being directed and generated in less developed countries?
Absolutely. In fact, we have data to suggest this that's coming in from China and from India, the two of the most populated areas in the world, which occurs for about 30% of the world's population. So there is a shift of tobacco and tobacco-related materials. The second is because of poverty and lack of sanitation, the other group of major cancer being caused is by infective diseases, very common in these areas. Infections like hepatitis B, infections like hepatic papilloma virus, HPV, they all cause cancers which are related, or even Helicobacter pylori. So CA stomach, carcinoma of the stomach, carcinoma of the gallbladder, carcinoma of the cervix, and as I said, hepatomas or hepatic cancers are very, very common in developing countries, which are usually not seen. And when you list them together, they are in fact making a bulk of the cancer all over the world.
So we could probably go on talking and talking and talking. It's been a fascinating interview with you. Dr. Gouri Shankar, thank you very much.
Thank you, ma'am. Thank you, everybody.